I often get asked, what are the factors that can cause a brain aneurysm? While we don't often know exactly why every aneurysm forms, we do know that there are factors that are more likely to cause an aneurysm. Sometimes cerebral aneurysms are the result of inherited or genetic risk factors from medical conditions such as connective tissue disorders that weaken the cerebral artery walls, polycystic kidney disease, where there are numerous cysts that form in the kidneys, as well as hereditary hemorrhagic telangiectasia. HHT for short is a condition where brain arteriovenous malformations are formed, which are abnormal tangles of arteries and veins in the brains that can disrupt blood flow and cause aneurysms. Even in people that don't have these genetic disorders, it's oftentimes that we find a patient with a brain aneurysm to have a history of a sibling or a parent that also has a brain aneurysm. Other factors for developing a brain aneurysm occur over time, and some of these we have control over, such as untreated high blood pressure, cigarette smoking, drug abuse, especially drugs like cocaine and amphetamines that raise the blood pressure to dangerous levels, intravenous drug abuse, which can cause infectious mycotic aneurysms, and brain trauma is another less likely risk factor for developing aneurysms. Also, while not all aneurysms will rupture, there are certain medical conditions and certain factors that increase the risk of an aneurysm rupturing when we do have an aneurysm. These include smoking, which is linked not only to the development, but also to the rupture of brain aneurysms, high blood pressure, which can damage and weaken the blood vessel walls in the brain. Size, we know that the largest aneurysms are the ones most likely to rupture. Location, aneurysms located in certain areas have a higher risk of rupturing than those at other locations in the brain. Growth, aneurysms that grow, even if they are relatively small, are at an increased risk of rupture. And, similar to aneurysm formation, family history, which suggests a higher risk of rupturing in aneurysms when another family member has had a ruptured aneurysm. The greatest risk occurs in individuals with multiple aneurysms and someone that's already suffered an aneurysm that's ruptured at a different location.